More than 30 million Americans have some form of diabetes. That's 1 in 11 Americans. And recently, medical groups and others have raised concerns that many diabetics are in danger, thanks to the rising price of insulin and an increasingly common practice known as insulin rationing. According to the American Diabetes Association, the average price of life-saving insulin nearly tripled from 2002 to 2013, costing many patients hundreds of dollars a month. That means patients with lesser means have to make do with whatever insulin they have, so taking lower doses than they're supposed to. And in some cases, it can lead to death. This week, some surviving family members are speaking out, and they're taking action. Joining me are Brittany Smith, a registered nurse from Minnesota whose brother Alec died while rationing his insulin, Antroinette Worsham, a mother of 4 from Ohio whose daughter died doing the same, and Doctor Vikas Saini, a clinical cardiologist and president of the Lown Institute, a think tank dedicated to promoting a just and caring system of health. Welcome to all of you. Doctor, I'll ask you quickly for the uninitiated, just tell us what insulin is and why it's so vital.
Insulin is essential for any human being to live. People with type 1 diabetes lose their capacity to produce insulin, and they require it from an external source as a medication.
Require it. Brittany, you lost your brother to insulin rationing. Tell us what drove him to have to do that.
Well, he was on my mom's insurance plan until he aged out at 26, and his options at the time and with his job were unaffordable, and so he was forced to pay the out-of-pocket cost, which ended up being about $1,300 a month out of pocket, and he didn't make it.
And did you have any sense that he was having to do that?
Not at all. No, he didn't ask for help at all, so it was out of nowhere.
And Antoinette, as I mentioned, you lost your daughter. You're here for a very specific reason. You all are. Tell us what you're doing tomorrow.
We are holding a rally, a protest in front of Sanofi, demanding to decrease the cost of insulin.
And you're bringing your daughter's ashes.
I am.
And what do you want them to understand? I mean, that is a very, very searing move that you're making.
I want them to understand that type 1 diabetics need insulin to live. I actually have a 18-year-old. She was diagnosed at the age of 12. And right now she's attending the University of Toledo for nursing. And it's kind of in her mind that when she graduates, she's going to be able to afford insulin. I had to tell her, you're still going to have a deductible that you're going to have to meet. So if Sanofi can just decrease the cost of the insulin, insurance companies, can cut the high deductibles, and just make this an affordable medication for type 1 diabetics, would be awesome.
And Brittany, you're a nurse. You must look at this and think this was so preventable.
It was absolutely preventable. Like you're both saying, insulin is necessary for survival. It shouldn't be this difficult to access.
Doctor, as I understand it, three companies control about 99% of the insulin supply in this country. So essentially, what are you accusing them of doing?
Well, essentially, they function as a cartel, whether they say so or whether it's formally that. And what you know is that when people need your product, the way people with type 1 diabetes need this product, you have enormous pricing power. We have recent studies that suggest to manufacture a vial of insulin is about $5. It's being sold for $250 list price. So essentially you have these huge markups, huge profits, and essentially people who cannot say no to that. That's really wrong, and that has to change.
Well, we've seen this with other examples too. The EpiPen, the Martin Shkreli drug that was used to treat in part AIDS patients. Do you have a sense in this case why they're doing it beyond what might be the obvious, just making money?
They're doing it because they can, and in a sense, that's their job as corporations. I think it's our job as citizens to ask that the rules change on things like this. I mean, I don't think this is a time when people are dying, when people can't afford your product. This is not a time for profiteering, and that's what we're seeing. There aren't really any adults in the room talking about this in the right way. So for our protests, we're also calling on the governor, the legislature, and health plans to be sure that patients who need essential medicines like insulin, and there are others, really get them free at the point of care.
Well, speaking of not being in the room, we did invite a representative from Sanofi to join us today. They declined but sent a statement reading in part, "We encourage anyone who is prescribed a Sanofi medicine and who may be having financial challenges or trouble navigating their insurance to call Sanofi Patient Connection, where eligible patients can be connected to the medicine and resources they need at no cost. We take this issue seriously and continue to explore innovative ways to find solutions to help eliminate or significantly reduce the out-of-pocket expenses for patients." They also listed a few ways they try to do this, including tying price increases to medical inflation as calculated by Health and Human Services, creating set pricing for insulin with cash payments, co-payment options, and a program they say provides free medication for qualified, low-income, uninsured patients. Brittany, I already see you're shaking your head. I want to hear the response from you when you hear this company saying this.
It's not an immediate solution. I would argue that someone who needed it immediately, who's in a crisis, who they can't survive over 24 hours without this medication, I would argue that that would not be obtainable within that time frame, and they would get that from what their statement
Antroinette, you were shaking your head the entire time, too. I mean, why did none of those solutions that they offered, why would they not have worked for your daughter?
For eligible patients. So you're saying patients who are already on Medicaid, who are already below poverty, who are eligible to receive their medication at no cost. The issue with us is we were over the income guidelines, so she couldn't afford it. She was kicked off of the Medicaid because of her age, because of her income. So what about those who can't afford it? Don't say eligible, because we know that they qualify for Medicaid. So what about the ones who don't?
Well, this suggests that there has been such a widespread issue. You're both here because you've lost loved ones. As I understand it, people are going on eBay to find insulin. There's kind of a so-called black market that has sprung up. People are establishing GoFundMe pages. I mean, how disastrous is this?
It's really bad. And the reality is, for every 1 or 2 or 3 people who have had the tragedy of the loss that these families have had, we know there are hundreds, if not thousands, who are struggling just to keep their head above water. We know that's true even in Massachusetts.
What do you anticipate from out of tomorrow and being able to affect some change here?
We want to send a message. We're not asking anymore. We're demanding that there's change. They're choosing profits over patients, and it's not acceptable. People are losing their lives. They're dying.
It worked for the EpiPen. It worked for some other drugs. Once there was blowback, do you think it'll happen here?
It has to happen, because this kind of situation really can't stand. The talk, the window dressing, the partial solutions are not going to solve the problem, and people are dying because of that. So the simplest, most innovative thing they could do, lower the prices. We calculate they could lower the prices by 90% and still have a 500% profit margin.
All right, well, we thank you all. Brittany Smith, Antroinette Worsham, Doctor Vikas Saini, thank you so much.